Hello, and welcome to the Chat Rap Show on Dillistan. बहुत बहुत स्वागत है आप सबका. Thank you for coming back. And as usual, every Saturday 7 p.m. में आपके साथ एक exciting guest लेके आता हूँ. और जी हाँ, इस बार भी एक बहुत बहुत interesting guest है हमारे साथ और उनका नाम है वैभव चौहान. मैं उनके बारे में आपको जरूर बताऊंगा, बट उससे पहले प्लीज इफ यू आर वाचिंग आवर वीडियो ऑन यूट्यूब, डू सब्सक्राइब टू आवर चैनल, do like the video and do share it if you find it interesting. We're also live on Facebook, and those of you who are watching a video on Facebook right now live, we're there as well, right? So like the page, share the video with all your friends, and just keep some patience, have some patience for some very interesting insights, very interesting stuff to know about COVID-19. हम न्यूज में बात करते रहते हैं, हम देखते रहते हैं, बहुत चीजें हम डिस्कस करते हैं, बट देर आर सम पीपल हु आर डूइंग immense amount of research is in पर्दों के पीछे. So I'm going to be talking to Vaibhav Chauhan ji today, who is the development expert at HCL Foundation. He has been doing a lot of research with his team on the pandemic mitigation efforts. He is an economist and an engineer by education and has worked in Uttar Pradesh. He is working in Uttar Pradesh on public health development. He has been working for them, sorry, rural livelihood ke liye or rural education initiatives ke liye. I love talking to such people because I get to know so much about what's the current situation and what has been done till date. So yes, without wasting any time, let's call Vaibhav, and I'm going to be talking to him right now. Vaibhav,
Hi,
welcome to the Chat Rap Show. How are you?
I'm good. I'm good. Thank you for calling me,
Are
Vikram.
it's our thank you so much for taking our time, Vaibhav. I think this show really needs such people who tell us such interesting information. I can't wait to get to that presentation which I've had a
Right,
look. थोड़ा सा देखा है मैंने. But
right.
please उससे पहले I would like our audience to know वैभव चौहान क्या करते हैं एंड वैभव चौहान क्या बताना चाहते हैं हमें. हमारी ऑडियंस जानना चाहती है आज. प्लीज
I'll present. Start with some personal information.
प्लीज डू दैट.
I am also. I've lived most of my life in Gurgaon, so I am also from this
ओके.
NCR. I've done schooling in Gurgaon, and post that I've done my engineering from Haryana, an IT coach.
ओके. ओके.
Post that worked for a year in Gurgaon and then went to Delhi School of Economics, which is
ओके.
one of the biggest schools of economics in India. And after that, I've done some research for organization called NCAP, which is part of Niti Aayog now, and for
ओके.
IRMA, the Institute of Rural Management in Anand. And I've taught for around 6 months. So I used to teach mathematical economics. And after
वो.
that, I got this opportunity with this non-profit, HCL Foundation, to work on a very unique project where we work with the government of Uttar Pradesh on development, rural development, on education, on public health, on agriculture, and on
हम्म.
livelihoods and water and sanitation. So, very extensive project that we're working on. And while doing my research earlier, I had some ideas on what the reality is. Economics is also has a subtopic called development economics. That also I had studied. And although the most of my understanding of what goes around, what is the reality, comes from experience on the ground, working on these projects. So we
Okay.
work in rural areas with around 6 lakh population,
Wow.
around 1 lakh households, and 700 villages. This project is going on. While working, a lot of things we encounter, a lot of realities we see and encounter, and through that, most of my understanding has come. COVID uh, came in my professional life, like it came in everybody's life, around March, April, where I joined a group of people who was working to see what is happening and try to work with governments and other not profits to mitigate
Yeah.
this disaster. Basically, it was a disaster. We had to mitigate it. We had to respond to it, and we had to see whoever had gone through that disaster, try to
Right.
uh, make their lives better. So that sort of work we started doing, and for that work, I had to get in and do a lot of research and churn a lot of data and get in, read a lot, and try to understand what the situation is. And across that 25-ish weeks, I have made a few slides, and a part of those slides I have brought in to the audience today to
Yeah,
discuss. Yes.
sure. So I'll just present that
Right.
presentation.
Yeah, we can start the presentation, but I would like to start with Vikram talking about his experience in with COVID.
So,
How did it? What was? Yes, and we'll take up from there. Yeah.
sure. So, considering the COVID experience, I would say the lockdown has actually gone into my head. It's not actually coming out really. It's actually, I mean, there are a lot of people who are going out like normal. Whenever I go out to get my groceries done, if you ask me as a person, I've seen people going out and having chaat pakodis, which I'm still scared to have.
Right.
So, I am kind of stuck in the time loop right now. Um, that's something which I haven't shared yet with the audience, and uh, kind of something which I mean, food is something I adore. I'm a foodie, so that's what actually is putting me down, not to get out of that situation. But yes, the numbers scare me as well. There are a lot of people who are getting scared with the numbers, and uh, the numbers somehow are. I mean, there are recovery numbers also. There are other numbers also, but every day I'm getting confused as to what is actually happening, what is the actual data, क्या हो क्या रहा है, चल क्या रहा है बॉस. इस तरह की एक फीलिंग आती है. इफ यू नो आस्क अ दिल्ली वाला, सो एक बोला हुआ है
Right.
चल क्या रहा है बॉस, हमें असलियत बताओ. तो उसको टाइप का एक एक एटीट्यूड है कहीं ना कहीं. बट yes, I am coping up. There are family members where me and my family, and we are taking care of each other. We have fought till now, and we are staying indoors as much as possible. There are many who are actually fighting. They are going out every day, and they have to go out. And I respect them. I salute them. It's a big risk they are taking, and um, well, I would like to again say that apart from COVID, there are many other things, guys, which are there, which you have to be worried about. I'm talking about other diseases and other infections, which is like SARS. We never spoke about it. We never spoke. I mean, we are not bothering about dengue right now. I think dengue is there. Dengue is also another thing which I am concerned about, but people are not.
I'll tell you a very surprising thing. What had happened was during the COVID, a lot of people, the frontline workers which are there,
Yeah.
one of
Sorry,
the,
your voice is cracking a bit. If you can,
hello, hello,
yeah,
hello, hello.
it's fine. Yeah, it's fine. Please.
So on the ground, one of the responsibility of frontline workers in villages is immunization.
Okay.
Because of COVID and the lockdown, last 5 6 months, the immunization program as a whole has taken uh, right. So newborn babies have to be given these immunization shots. So
Yeah.
these sort of multiple effects this pandemic has had, and
Hmm.
uh, sort of unavoidable. Nobody
Hmm.
can. It is not that a person would increase their movement and their interaction with people. So it's a double-edged sword, right? You have to reduce interactions and you also have to. These are very essential services that the government gives. So these sort of challenges have
Yeah.
come up on the ground as well. So let's start with
Yeah.
Vikram. What we have the first slide, which is
Sure.
sort of a map on where we were and where have we reached. Uh,
Sure.
right. Yeah. So this is daily how many infection cases, confirmed cases have come as
Hmm.
reported by the government, and the data sources is Johns Hopkins. So Johns Hopkins and people like that are doing a good job. They and there is a website called COVID19India.com as
Hmm.
well. So these people are doing a lot good job by creating a repository of all the data so that people like us can use it. And what we see is that one insight from this is that finally at the end of September we have reached some sort of a peak in the daily
Okay.
number of cases. So this just means uh, that number of cases happening, coming out, reported daily has
Yeah.
peaked, and it peaked around 92 to 95,000, and at the first or second week of September,
Okay.
and then it went down. Now it is coming out around 80,000 daily
Mhm.
cases. So this is
Mhm.
what this slide is, and we can see this as a journey that we as a nation also took from April onwards. How
Right.
the growth was pretty much exponential, and how the number of cases increased. Right now, we are around 6.5-ish million people who are uh, infected, and this is what daily was happening. And
Okay.
we have gone through multiple phases within how, as a country, we from 30th uh, January, the first case was there. Then we did a lockdown. Lockdown was very controversial. People have a lot of opinion on was it necessary. A lot of unintended consequences were there. So our first section in this presentation is on the lockdown. So what did it do? Was it necessary? Was it helpful? And
Sure. Let's just
then
move to that.
we had to unlock as a nation. Right, please. Can we go to the next one? Right.
There
This
you go.
is a very interesting slide, sort of graph.
Sure.
So if you see what I've compared are four broad regions. Although by population we are they are lesser than us. So United States, Brazil, European Union, and India. But these are huge chunks and behaved differently to what how India behaved to the pandemic. As you can see around the number 40. So number 40 is the number of days from the first case or 10 cases in the country. So it
Yeah.
is just made so just to equalize the starting date. If you see
Okay.
around day 40, European Union and United States had their first peak.
Hmm.
While if
Hmm.
you see India at the same time or in the pandemic journey, did not have that many cases. And that we can largely attribute to the lockdown in April that we had.
Wow.
So
That's
you can
interesting.
assume that day zero for India is around 4th of March.
Hmm.
And so 15th, still on 15th April, if we count from there, the first peak was already there for United States and European Union. European Union, of course, on numbers were early, but this is equalizing the start date.
Okay.
Then, if you see India's journey was gradual up, as we see in the last saw in the last slide. United States, on the other hand, have already had two peaks. As you
Hmm.
can see, it is going for the third one as well.
Yes.
Uh, Yes. So the second peak happened because they, due to some political understanding, had to open up quickly. And because of that, the second peak came up. European Union now, which is a dangerous sign for India as well, is having the second peak, is going towards the second peak. I'm not yet sure. We have not yet looked at European Union where it is going to peak and when, but that is the dangerous sign for India and the first sort of insight for us that we should not be complacent
Okay.
because as you see from the graph that uh, pretty much went down. So the European Union, the yellow one, went up and it went down for a considerable 80 or 90 days. Then it started catching up again once they started locking. Once they started to ease a few restrictions, and so that is one thing that we need to, one insight that we need to look at. Let's not be complacent, although we have peaked, but. Uh, uh,
Vaibhav, your voice is cracking a lot. Just
Hello,
make
hello.
sure. Yeah, I think it's the internet, maybe. Just a
Yeah.
second.
So I think I'm going very slowly. Let me pick up some pace.
Yeah.
Right. Right. Can we start? Yes.
Please,
So,
yeah, please
yeah.
continue.
So can we? Yeah. The next slide is. So we
Sure.
can conclude that the lockdown worked, but does it really work? So there was a paper out in very reputed journal called Nature. It shows that uh, lockdown is the most effective manner in which they compared multiple countries, and basically the conclusion is that uh, school closure, self isolation, lockdown. If you can see on the left, these two lines of lockdown has the most relative reduction in your R numbers. So lockdown is effectively the most effective manner in which this could have been reduced. So research also says, and we also somewhat concluded that lockdown worked, but there is a lot of issues which happened later on. Can we come to the next slide, please?
Sure.
Again, so can we come to a similar conclusion? That
Okay.
lockdown worked, right? So this is sort of a mental model which we use to understand the numbers actually. So
Okay.
this is called an SIR model. So there is a population which is susceptible, and from there people get infected, and some of them gets removed are the ones who get infected and or either uh, die. So the number of new infections happening depends on this, the middle one, infection, how many people are currently infected. Because right, can we come to the next slide, please?
Sure.
Using this model, we had also predicted where the peak is going to be, and prediction was around 5.4 million people infected, and around in September, and I think somewhat close to what actually happened. We
Okay.
reached this we made around April, this prediction.
Vaibhav,
So,
I'm so sorry to interrupt you. The voice
right.
is cracking short. Is it possible to reconnect maybe? Because
Yes,
I'm
please.
not sure if the audience is able to hear you properly. It's very important information, so I wouldn't want to, you know,
Right,
let
sure.
this go away. Sure. So here we talk about very interesting and important information, and I would really want all of you guys to stay with us because yes, someone is commenting that this is that scary, and please let us know about the update on vaccine. I would say the update on vaccine is something I'm not very sure about. While we have to just listen to the government news and info, uh, I'm just getting Vaibhav reconnected because there was a lot of disturbance, so he's going to be back very soon. Thank you so much for that comment. Very detailed data, and we're going to be back. He's just getting reconnected. So please stay tuned because if you're watching us on YouTube, do subscribe to our channel. We're going to get a lot of interesting videos like these. This is just the beginning. So Weber is just on his way to reconnect. And Facebook users, all of you guys, please make sure that you like our page, share the video so that people over here and everybody in Delhi and India are able to get this sort of information. And these kind of predictions and these kind of data are something which actually give us a lot of insight. And I think these kind of insights help us to understand as to what the next step should be. However, there are many experts sitting over there and who are actually talking about things, but I think this kind of data is actually something which will help you to understand where we are actually standing. And this is the sort of data and news we should be talking about rather than a lot of other issues which we should not be talking about. I think Weber is back.
Right, sure. So this
Hi,
is
Weber.
should be, yeah. I hope I'm audible right now.
Yes, yes, please continue.
Right. So
Please.
this is one prediction we made, and yeah, as you can see in the next slide, we were somewhere
Sure.
close to it.
I'll move to the next
Uh,
slide.
yeah, which is the same slide that we had shown earlier. We were
This
similar.
one.
Yeah, so can we go to the next slide after two, three slides after this? Right. So this is very interesting.
Okay.
So before that,
Very
before that,
okay.
before that, this is very interesting. So Google uh, monitors what sort of, as per your baseline, what sort of uh, uh, trips all of us as a combined in India are making. So it said we reduced our retail and recreations trip by 72%. This slide shows that actually people, because of the lockdown, did not
Oh,
move a lot. These numbers are still, there is some challenge in the numbers right now. They are not showing, they have uh, these numbers are still minus 36%. So another
oh.
thing is that we have not till now completely opened up. So that is the point I wanted to make. And if we open up completely, schools open up, malls open up, we might see again peak. So again, no room for complacency. This you
What
can
is
check
your
out.
what does your research say, Vaibhav? Because if you're trying to open up, is it because of the economy? If you're trying to get back on track and open up everything, what is your take
Yeah,
on it? Because you spent so much of time on this kind of a research. What is
right,
your
right.
take?
So I think the next slide would answer it perfectly, your
Great. I
question.
will move to that then.
Yeah. So this is from McKinsey, and if you
Okay.
see a lot of the first two rows, the first
Right.
talks about countries which closed down when opened up when actually all the infections became zero. It became zero, then they opened up, like South Korea and uh, Wuhan, Hubei. Then there
Okay.
are countries which opened up again when the infections was on a decline, right? Like
Okay.
Spain, Italy, and Germany. India, because of your economic reasons, like Nigeria and Pakistan, had to open
Yeah.
up even when the growth was there. So this is what our reality is.
I
Although
know.
and although at the start of the lockdown, uh, we did really well to restrict, as we saw from the first graph, to restrict the infections. But then economy came in,
Wow.
right? And we had to open up, and this is what the reality of India is. And also, we saw a lot of unintended consequences. One
Right.
difference is there, uh, although I would like to point out that
Okay.
Hubei, China's strategy was also very strict lockdown, and India also tried to emulate that. We were right in our thinking, and we should not
Mhm.
blame Modi or whatever. No. We were right in our thinking, but Hubei also implemented the T's, right? The test, track, and your contact tracing and all that, right? Really well.
Yeah.
India, on the
I
other hand, because of certain constraints in our institutional capacities, were not able to
okay.
do that. Hence, we were not able to catch. We locked down very strongly, like
Hmm.
your Chinese. Although the second part of the deal, which is track, trace, and test, we
Okay.
probably were not able to do as effective. I have one slide on that as well, that which is slightly older. We don't have much evidence on that now. Can we
Is
come?
it
I
on the
think
next
the next
slide?
slide.
Okay.
Maybe. So no, after that as well. Sorry. So it is later. So, so go back to the migration one only. So that
Sure.
slide basically tells that the states, the ICMR did a research saying that state which did contact tracing and testing and tracking more effectively had a better COVID result. And that is what that slide basically saying. And that means that these second intervention, uh, I think there's a question. I think
Yeah, so
that
there's a
this is
question. No,
the
it's actually a
answer
comment
is
which
yes.
says actually a comment
Yes.
which says a recent study shows that infected patients can spread the
Yes.
virus up to 90 days after recovery. Do you think that can also be a reason of second wave?
Uh, so, um, so there are very few people which,
Okay.
in medical parlance, we are calling, I guess, long COVID, who
Hmm.
are going through this longer phase of COVID. So there is some, I think, documentation on that. Second thing is that people are getting COVID again. So that
Okay.
is, I'm not sure what she's mentioning. Is it the second thing, or is it the getting COVID again? So this has been proven and researched and well documented that people are getting COVID again. Even in India, there have been multiple cases. That might also, as she's saying, might also lead to a second wave, which could be a little more dangerous. I would also add in a little bit and talk about your Spanish flu, right? Spanish
Okay.
flu happened exactly 100 years back, very similar to this. And two
Okay.
things are
Yeah.
there. Second wave was way more deadlier than first.
Okay. Okay.
And India had the most cases, up to
Oh,
five to, yes, in the world.
could you repeat
So
that? How many?
around 5% of the whole country was infected
Oh, wow.
in India.
That's a lot.
Right, I had a slide, but I did not include it. But India, again, in that 100 years back, also same thing happened. History repeated itself.
Wow.
You can say same. There were anecdotes that Ganga Yamuna was filled with dead bodies, and a
Oh
lot
my
of
God.
horrid things that happened 100 years back exactly, around 1919, 20, 1819.
Okay. Hmm.
Yes. So we locked down and there were unintended consequences as we see. This is a very interesting graph. We could talk about it anecdotally, people from UP,
Okay.
Bihar, but we have to be very empathetic about these people because there are not that many opportunities. This graph shows where the main migration, what the migration patterns in India. This is basis census data that
Okay.
charts we created. On the
Okay.
left, you can see UP and Bihar are the most highlighted. These are the states. 30% people migrate out of UP, and whoever is migrating for short-term migration for livelihoods for their income.
Oh, okay.
So yes, and two where. So you'll see Maharashtra and Delhi and Punjab and Gujarat and these
Yeah, in
places.
the
So
second one and the third one.
these two are interesting. Third is from Uttar Pradesh where people go usually. So it says that 30% people migrate out of UP, 18% out of BR, out of all migrants in India. So
Okay.
this reality we have to be very cognizant of. And where do they go to? 22% go to Maharashtra, 15 to Delhi, and 9% to Gujarat. So to the
Okay.
industrial places. So this reality we have to be very cognizant of. There are few thoughts that researchers have told about. Said that they usually come back in the season when lockdown happened. So that also led to a lot of people going. So usually they come back for sowing and for your
Yeah.
that coincides with your agriculture season, start
Vaibhav,
of the new end of the last
how scared you've been doing this since I don't know when, since the
5
beginning,
years.
since 25 weeks. How scared are you with the reality of these kind of facts?
Uh, so I am. Reality is pretty grim,
Hmm.
right? As a person, uh, like everyone, because whatever research you read, but you behave in a similar manner to people. I have gotten used to it actually, and a little tired of it as well, personally, and wanting to go out, and all that is happening. Scared for sure, I'm there, and we should. If things are not going to be normal, at least a couple of years now, and
Yeah.
that I'm sure of. And we have to live with these masks and live with the social distancing and the behavior which we have thankfully taken in, right? And that is what we are in, and we have to be like that because anecdotally as well, you see a lot of horrid stories within your networks as well, that people who were good and who were healthy one day found out their blood oxygen is not reading that well, and then you know how it goes.
For
Now,
a
if we can
couple of
come to the,
years,
yeah,
is like a scare to
this
me.
is the new normal. Think of it as a new normal
Okay.
because, right, unless,
Okay.
so we have a section on vaccines. Unless vaccines
Sure.
come in, and vaccines are not expected uh, at least by next year, start first quarter.
We actually had a
Good
comment for the
vaccines,
vaccine. Yes,
good
someone did
vaccines,
comment that
good.
please let us know what is the update on the
Yeah.
vaccine. So
So
next
I
year is
have
what you
a
say.
Yes, I have a slide on when is the vaccine trial, when are the vaccine trial going to be over, and
Can I move on to that one?
that's
I think it'll clearly answer
yes, yes, please, please,
someone
please,
was
please.
commenting.
Yeah, it is on later on. We can skip this if we'll take a few points here on numbers
Sure. Let me
later
know
on.
if I'm
We
on
will.
the right slide when I'm scrolling. Vaccine and testing. Here it is.
Yes, yes, go ahead. इसके आगे जाओ ना तो there is a slide which has आगे और आगे और आगे और आगे. Next. Yeah, this one.
This one?
इससे पहले this one, yes. So vaccine study completion dates. This is talking about. This is from Bloomberg. So these are the five vaccines we are looking at. These are one of the top vaccines, and apart from the Chinese and the Russian ones, Sinovac is Russian. These are the private sector vaccines, the top four, which are the most in the advanced stages. As you can see, quarter four, if you see quarter four, uh,
Mm-hmm.
below that, that is when most of the trials are getting over.
Oh, okay.
And yes, and it takes around a month to get all the official stuff done and all the approvals to be taken. That is when the first vaccine would be available. Now, when would it reach you? That is another question altogether,
Wow.
right? Because पहली वैक्सीन हमारी जनवरी में आ रही है, मान लो फर्स्ट वाई अप्रूव्ड, ठीक है.
Hmm. Hmm.
That is also again, if the one of these four uh, गेट्स अप्रूव. इसमें बहुत बड़ा इफ है कि इन ये चारों में से एक अप्रूव हो रही है और इट्स फाउंड इफेक्टिव. If
Acha.
one out of these four is found effective and approved, then we'll get the first vial, which probably the Prime Minister of India will take, or other prominent people and the frontline workers and your army, and these people most likely would be the first one to get.
Oh,
Yeah, then in maybe in the mid of, because it has a production involved, right? Somebody has to produce it, and know that we are a people of 1.38 billion people, and for
wow.
you to
That's
reach it, right, and it is probably going to take time,
but
you know.
Vaibhav,
These
I
are the
think
realities we have to look.
Vaibhav, we have a comment which also says that what happened to the Russian vaccine, which was almost at the
Right.
end
So I'll tell you
phase.
what Russian, yes, Russian
Okay.
vaccine. There are three phases of vaccine trials, right? अब क्या होता है ना, वैक्सीन ट्रायल्स है ना इजीली होते नहीं. क्यों नहीं
Hmm.
होते मैं बताता हूँ, बहुत क्लियर है.
Hmm.
अब जैसे दवाई है, दवाई तो तुम
Hmm.
उस आदमी को दे दोगे
Hmm.
जो कि बीमार
Hmm.
है ना. बीमार है, तुमने दवाई दे दी, 15-20-100 लोग जो बीमार थे उनको दवाई दी और उनको
Hmm.
टेस्ट किया भैया क्या दवाई का असर था. उसमें प्रोटोकॉल्स होते हैं, कुछ लोगों को दवाई देते हैं, कुछ लोगों को नहीं देते, है ना. उसको बोलते हैं प्लेसिबो. तो
Acha.
वो फिर प्लेसिबो से कंपेयर करते हैं भाई कि तुम्हारी दवाई कितनी इफेक्टिव थी,
Acha.
है ना. अब ऐसे होता है दवाई का ट्रायल. वैक्सीन में क्या दिक्कत है यार, बहुत सिंपल दिक्कत है.
Hmm.
तुम प्रिडिक्ट नहीं कर सकते किसको कोविड होगा, किसको मैं वैक्सीन दूं. तो अब क्या कर सकते है ना. तो
Hmm.
अब क्या करते
Hmm.
हो आप, है ना, कुछ खूब सारे लोगों को वैक्सीन दे देते हो, फिर उसमें से कुछ लोग तुम्हारे पॉजिटिव एक्चुअली में होते हैं. लोग बाग जो
Acha.
नॉर्मल जिंदगी में जी रहे होते हैं, इधर उधर घूमते हैं, है ना, और
Hmm.
वो पॉजिटिव होते हैं, फिर उनको तुम टेस्ट करते हो,
Oh God.
है ना. इसलिए तुम
Acha.
देखोगे जो एस्ट्राजेनेका की है ना, 30,000 लोगों पे ट्राई करेंगे वो, और उसमें भी कुछ मान लो 5% पॉजिटिव
हम्म,
है ना, देन व्हाट इज 5%? 1% ऑफ दिस इज 3,000 है ना, whatever है ना, सो 300, सॉरी 300, सो 600 लोग,
अच्छा।
5% है ना, 1,500 लोग उनको मिलेंगे जो ठीक है, क्या नाम है, जिन्होंने किया, उसमें भी फिर ग्रेड्स होंगी, दो तीन वो देते हैं, वो डिफरेंट मिक्सचर और डिफरेंट कॉन्सेंट्रेशन की देते हैं, है ना,
हाँ।
तब उनको जाके पता चलता है कि भाई, नाउ थिंक ऑफ द एड्स वैक्सीन यार, ये तो कोविड है, काफी लोगों को हो रहा है, व्हाई वी डोंट हैव अ एड्स वैक्सीन? because
हाँ।
you cannot, right, because person has to get AIDS or in fact get infected, and prior to that he is supposed to get the vaccine and then get infected.
हम्म।
So they give this vaccine to a group of population which is
हम्म।
more likely to get the virus. So it's very difficult process. एक बहुत चीज, एक सिंपल सी चीज है, बहुत डिफिकल्ट है, और उसकी
सो
वजह से
बेसिकली
क्या होता
अगर
है।
सिंपल लैंग्वेज में बताए तो 4 महीने तो ये लग रहे हैं, उसके बाद अगले साल कौन से मंथ में आती है, यू कैन नॉट टेल।
हाँ हाँ राइट, दैट इज देयर। अब रशियन वैक्सीन के साथ क्या बन गए हैं कि उन्होंने
हम्म।
फेज 2 और फेज 3 ट्रायल करा है, ये किसी को पता नहीं।
अच्छा।
उन्होंने, हाँ उन्होंने फेज 1 ट्रायल के भी अनाउंसमेंट के 1 डेढ़ महीने बाद उनका 1 महीने बाद उनका फेज 1 ट्रायल का जो रिजल्ट है वो
हम्म।
पब्लिश हुआ है, तुम्हारा लेंसेट में हुआ था शायद, है ना, वन ऑफ द मेडिकल
हम्म।
journals. In that they
हम्म।
publish that it is doing good. Unless you do phase 2 and phase 3 trials, you will not going to know what side effects effectively are coming in, or is it effect the, अब क्या होता है, एक अभी जो एस्ट्राजेनेका की सबसे पहली वाली वैक्सीन है ना, इसका ट्रायल बीच में उन्होंने रोक दिया था। क्यों
हम्म।
रोका था? क्योंकि एक बंदे को एक कॉम्प्लिकेशन आ गए थे। अब आप समझो,
हम्म।
है ना, अब उन्होंने रोक दिया था पर उन्होंने फिर से चालू कर दिया। अब सोचो 1,500 लोगों में से एक बंदे को वैक्सीन कॉम्प्लिकेशन आते हैं, और हम पूरे देश में सबको एक 1.3 बिलियन लोगों को दे देते हैं वैक्सीन,
हम्म।
तो
हम्म।
हो सकता है बहुत सारे लोगों को कॉम्प्लिकेशन आ जाए,
हाँ।
है ना। सो
हाँ,
अनलेस
वो
यू
रिस्क
डू
है।
दिस साइंट, है ना, बहुत बड़ा रिस्क है, अनलेस यू डू दिस साइंटिफिक ट्रायल्स, यू कैन नॉट एक्चुअली नो हाउ द इफेक्टिवनेस, और ये जो रिस्क इन्वॉल्व है इसमें, विद वेरी सिग्निफिकेंट एंड एक्यूरेट नंबर, है
हम्म।
ना। इसलिए जो फेज 2 फेज 3 बहुत इंपॉर्टेंट है। इसलिए अब रशियन वैक्सीन इज नॉट दैट, इट्स नॉट दैट कॉन्फिडेंस इंड्यूसिंग, बिकॉज फेज 2 एंड फेज 3 उनका पता नहीं हुआ है कि नहीं हुआ।
कॉम्प्लिकेशंस आए होंगे तभी तो कुछ हुआ
हाँ
होगा, तभी
पता
कुछ
किसी
ना
को,
कुछ।
nobody knows, nobody, because
nobody knows,
everything is
obviously
in
it will not be
secrecy.
out, it can't be out, secrecy में, right?
Although your all these वैक्सीन, अब इसमें से इन सब में से ना सबसे जो बढ़िया लोग है ना वो एस्ट्राजेनिका वाले हैं। एस्ट्राजेनिका विद ऑक्सफोर्ड इज मेकिंग अ वैक्सीन। अब इन
Hmm.
लोगों ने ना, इफ यू कैन कम टू द नेक्स्ट स्लाइड, आई थिंक वेरी इंटरेस्टिंग ऑन
Sure,
वैक्सीन।
sure, I'll just come to. Very
यस
interesting, Vaibhav. I think this is very, very useful information.
राइट, इफ
And
यू कैन कम टू
people,
द
yeah,
नेक्स्ट,
just
आफ्टर
go
दैट
ahead.
आफ्टर दैट आफ्टर दैट आफ्टर दैट तो दिस इज वेरी इंटरेस्टिंग। यूएस की गवर्नमेंट ने 13 बिलियन डॉलर दे आर हैव स्टार्टेड, आउट ऑफ दैट 3 बिलियन दे हैव स्पेंट ऑन बाइंग ऑल दीज वैक्सीन्स।
Oh.
दिस, अब ये लोग क्या कर रहे हैं, ये लोग ना खरीद रहे हैं, इन्होंने सारे, ये सारी कंपनीज तुम देख रहे हो, इनके
Hmm.
साथ टाई अप्स पहले ही कर लिए हैं, अप्रैल जुलाई तक कर लिए,
Hmm.
और
अच्छा।
दे हैव,
Okay.
यस, सो वैक्सीन बनने के बाद जो दूसरा सबसे बड़ा कंसर्न है वो डिस्ट्रीब्यूशन का है।
Hmm.
किसको मिलेगी यार? अमीर लोग को मिलेगी, गरीब लोग को मिलेगी, इंडिया को मिलेगी, यूएस को मिलेगी? यूएस ने तो 15, क्या नाम है, जुलाई से ही ना बहुत सारे $3 बिलियन, 13 दे हैव ऑलरेडी कमिटेड टू
Hmm.
बाइंग दिस, है ना।
Hmm.
तो ट्रम्प को गाली देते हैं लोग, बट ही इज डूइंग समथिंग गुड फॉर देयर कंट्री, बट फॉर अस इट्स
Okay.
डेंजरस, है ना,
Yeah,
बिकॉज वी
it
डोंट नो
is.
कब मिलेगी। ऑल्दो इंडिया के साथ एक फायदा हो जाता है, इंडिया के साथ फायदा ये हो जाता है, इंडिया इज द मैन्युफैक्चरिंग हब ऑफ वैक्सीन।
Is the,
इंडिया
sorry?
मैन्युफैक्चरिंग हब, यहाँ पे सारी वैक्सीन बनती है,
अच्छा, हाँ हाँ हाँ।
है
Hmm.
ना। तो उससे क्या होता है कि इंडिया गेट्स सम सॉर्ट ऑफ गुड पोजीशन इन द
एडवांटेज।
डेवलपमेंट
हम्म।
एडवांटेज,
हम्म।
इसलिए थोड़ा बच जाएंगे। नाउ थिंक ऑफ somebody like पाकिस्तान, नेपाल, बांग्लादेश, है ना? When would they
हम्म।
give it? They don't have the dollars like US.
खैर वहां तो केसेस भी इतने आई मीन नहीं है, दे
Nobody
एक्चुअली
knows
नॉट।
यार। हाँ, अब ठीक है, तो let's
Well,
go to
as
the
far as
numbers
they
part.
are, as far as they are portraying the numbers in front of people, is that
Right.
we have actually eradicated coronavirus. We've gone back to our economy. हमने कोई लॉकडाउन नहीं करा. So that is the kind of thing they are portraying in front of everybody. आप
Right.
बताओ असलियत क्या है?
हाँ नहीं, वैक्सीन मैं तो बताता हूँ। वैक्सीन में एक और पॉइंट वाला है। तो पहली वैक्सीन है ना, इसमें मैंने
हाँ,
कहीं तो पढ़ा था, इस लास्ट में जाओगे तो लास्ट लास्ट टू लास्ट स्लाइड,
sure.
कि रेस्ट ऑफ दीज वैक्सीन्स
Hmm.
rest of these vaccines are very expensive. Your Moderna one, these are thousands, some of 1000, 18,000, 15,000 इतने की ये पड़ेंगी। पर जो
Oh,
एस्ट्राजेनेका की है, इन्होंने कहा है 450 रुपए में बेचेंगे,
अच्छा.
क्योंकि यही वैक्सीन है। हाँ, प्राइस भी बहुत मैटर करता है, क्योंकि इंडिया में ऐसा नहीं हो सकता कि सारे फ्री में ले, सबको फ्री में मिले,
Hmm.
कुछ
Hmm.
कुछ को मिलेगी, है ना? तो
Hmm.
एस्ट्राजेनेका की है वो सबसे सस्ती है, as they are talking about, it would be around 450 rupees.
Okay.
Rest would be thousands of rupees,
अच्छा.
because these other people are here to get some profit. ऑक्सफोर्ड वाले जो लोग हैं, उन्होंने कुछ मतलब they are a little good at heart and they are trying to get it at a lower cost.
But that sounds very fishy because when AstraZeneca, as they say, whatever however you pronounce it, it's actually at one of the last stages of testing,
Yes, it
and
is. It is.
they've already fixed a price which is less than any
All
other.
of them. So I'll tell you what, because
Yeah.
ये प्राइजेस कहाँ से आए हैं, ये जो जैसे यूएस खरीद रहा है ना, इन्होंने कोट किया है इनको,
हाँ. अच्छा.
तो
अच्छा.
वो इंफॉर्मेशन मिल गई है लोगों को कि कितना कोट किया है ना? वहां से
Okay.
आए हैं। आई एम नॉट श्योर कि मतलब, बट दीज आर रेप्यूटेड पीपल। इंडिया में भी जो बन रही है, वन ऑफ द बिगेस्ट जो मैन्युफैक्चर है, जिसको बोलते हैं सीरम इंस्टीट्यूट, ये
Okay.
आधार पूना वाला फैमिली है, वो उनका एक कंपनी है, सीरम इंस्टीट्यूट इन पुणे। दे
Hmm.
आर वन ऑफ द बिगेस्ट मैन्युफैक्चरर्स। दे हैव डन अ कॉन्ट्रैक्ट विद एस्ट्राजेनेका to make it in India, and they are also
Hmm.
doing a parallel pilot sort of trials in India as well. So price is also a big क्या
Price
बोलते
has
हैं
a big
point,
role to play. Yeah.
big role to play later on, है ना, when it comes. So let's come to the second section. हमने लॉकडाउन पे तो काफी थर्ड सेक्शन, सेकंड सेक्शन इज सम रिसर्च दैट वी हैड डन। उसमें बेसिकली पॉइंट एक बहुत सिंपल पॉइंट है, इंडिया
Hmm.
इज डूइंग बेटर इन टर्म्स ऑफ योर केस फैटेलिटी रेट। केस फैटेलिटी रेट इज कितने जो केसेस रिपोर्ट है उसमें कितने फेटल होते हैं, बिकॉज
Hmm.
जस्ट बिकॉज ऑफ आवर डेमोग्राफिक्स, है ना?
Okay.
So that means because our population is younger, a lot less people are dying.
Okay.
There is no other. So we try to find out what is affecting this case fatality rate. Answer was simple, and everything else was insignificant. Demographics was the only thing significant. And we should, जो हम कई बार सरकार also tries to say कि lot less people are dying. There is a graph as well. We'll look at it. If you come
Okay.
to the third section,
Third
how the
section.
case fatality is lower than the world average in India. Answer is
That
very
one.
simple. It's just ऊपर section.
That,
I think it's called numbers. ऐसे कुछ है इसका नाम।
wait, I'll just go to the.
Yeah. Answer is simple. Answer is uh, this is because और ऊपर हाँ, ये वाला section. Right, coordinates. Answer is because of demographics. We can come to the next slide. We can skip this. What's this? Right. So ये कुछ थोड़ा सा है कि क्या होता क्या है। So जितने लोग इन्फेक्ट होते हैं उसमें से यहाँ 70 लिखा हुआ है, पूरा थोड़ी पुरानी स्लाइड है। 30% ऐसे होते हैं जो बेसिकली सिम्टम ठीक ठाक उनके अंदर सिम्टम आते हैं। 70%
Mhm.
ऐसे होते हैं या उनके अंदर माइल्ड सिम्टम होते हैं या फिर
Hmm.
सिम्टम नहीं होते। तो एक्चुअली में जो एकदम एसिम्प्टोमेटिक है, रिसर्च केम ऑन लेटर, उसका कुछ परसेंटेज 20% के करीब है। तो एक्चुअली में कोई
Okay.
सिम्टम नहीं दिखता, बट कुछ थोड़ा जुकाम दिखाएंगे, थोड़ा खांसी दिखाएंगे। 30%
Hmm.
ऐसे हैं उसके ठीक ठाक सिम्टम आते हैं। उसमें से 12% ऐसे हैं है ना। जो
ओके।
सिम्टम दिखा रहे हैं उसमें से 12% ऐसे हैं जिनको हॉस्पिटल की नीड होगी,
अच्छा अच्छा।
है ना। तो टोटल जितने भी लोग इन्फेक्ट होंगे सिर्फ 5% ऐसे हैं। दिस इज वेरी मतलब देखने वाली चीज है। 5% ऐसे हैं जो कि सिम्टोमेटिक होंगे, मतलब जो कि दैट वुड रिक्वायर हॉस्पिटल, और
अच्छा,
उसमें से भी लेस देन अ परसेंट। अब इसमें दे जो उसमें कितने डाई करेंगे ना आउट ऑफ ऑल इन्फेक्टेड, वो नंबर बहुत कंट्रोवर्शियल है
just to
ना
make sure,
उसमें।
Vaibhav, just to be clear for our audience who are watching this right now, this data is related to India, of course,
No, this is
right?
not. This is a general.
This is not
This is a
India.
general. This is not. This is general data
This is
out of
general data.
WHO. Yeah, out WHO and these cases.
Okay,
It's right. This is
okay.
not.
And this is
Not India.
general data. Okay, great.
Yes, this is generally what happens. You know?
All right.
And
Please
then there are
continue.
comorbidities. Can we come to the next slide, please?
Sure.
In India, this data is around जो तो 5% है ना, that is around, you can say 3.5 ish.
Okay, okay.
That is 3.5 ish. ये मैं इसकी बात कर रहा था, केस फेटेलिटी रेशो की। अब केस फेटेलिटी is out of all those who we have registered as infected, how many of those infections would be fatal? So you see there is a difference. ऊपर वाली नीली लाइन है वो ग्लोबल है, नीचे वाली लाइन है वो इंडिया की है। देयर इज अ क्लियर इंडिया की नीचे है। तो
Okay,
जो मैं
niche.
बता रहा था इंडिया के
Right.
नीचे क्यों है, क्योंकि इंडियन पॉपुलेशन इज यंगर,
So
देयर इज नो अदर।
everybody who's watching, the global line is the blue colored line above on top,
यस,
and for the global के blue वाली ऊपर है and red वाली for India. So everybody
इंडिया
who's
इज।
watching, that is the
सो
clarity. Please continue.
इंडियाज केस फैटेलिटी रेशियो करंटली इज 1.55।
Okay.
सो दैट मींस आउट ऑफ क्या बोलते हैं, आउट ऑफ 100,000 people who are reported as infected, 15 of them cases would be fatal।
Okay.
1000 में से 15 लोग इंडिया में जो देखा गया। तो इतनी डरने की जरूरत नहीं है। ऑल्दो इसमें ये जो केस फैटेलिटी रेशियो है, एक
हम्म।
दूसरा रेशियो होता है, वो होता है इन्फेक्शन फैटेलिटी रेशियो। अब
अच्छा।
इस दोनों में फर्क क्या है, इसमें बहुत कंट्रोवर्सी है। अब इसी में पूरा जो कोविड के नंबर का गेम है ना, इन दो रेशो में ज्यादातर निकल
हम्म।
जाता है। केस
अच्छा।
फेटेलिटी रेशो, इन्फेक्शन फेटेलिटी रेशो। अब
ओके।
इन्फेक्शन फेटेलिटी रेशो क्या है कि आउट ऑफ एवरीवन हु इज इन्फेक्टेड। अब केस और इन्फेक्शन में फर्क है, क्यों है? ऐसे खूब
हम्म।
सारे इन्फेक्शन होंगे जो जिनको पता नहीं किया गया होगा,
ओके।
पता नहीं चला होगा
हम्म।
कितने। अब वो
हम्म।
करने के लिए अब 2-3 स्लाइड अगर आगे जाओगे तो एक काफी इंटरेस्टिंग नंबर्स हैं ये। आगे आई थिंक इट्स 2 स्लाइड्स आफ्टर दिस,
श्योर।
नॉट दिस, नॉट दिस, यस। तो दिस इज सुपर इंटरेस्टिंग। अब ये
ओके।
स्लाइड क्या कह रही है कि इंडिया ने एक, आप न्यूज में भी बहुत देखते होंगे, सीरो प्रेवलेंस स्टडीज होती है, सीरो सर्वेज होते हैं।
हाँ हाँ।
इसमें क्या करते हैं
ओके।
ये, एक पॉपुलेशन में जाके एक रैंडम सैंपल उठाते हैं,
हम्म।
है ना, और उनका चेक करते हैं उनमें एंटीबॉडी पाई गई कि नहीं,
अच्छा।
है ना। एंटीबॉडी क्या होती है भाई? तुम अगर सही हो गए, है ना, तुम्हारी इन्फेक्शन हुआ,
हम्म।
सही
हम्म।
हो गए, जो जो आपका इम्यून रिस्पॉन्स जो मॉलिक्यूल्स छोड़ता है ताकि आप फिर से अगर इन्फेक्ट हो उनको पता चल जाए भैया ये कोविड फिर आ गया, उन चीज को बोलते हैं एंटीबॉडी,
अच्छा अच्छा।
है ना भाई। तो दीज आर योर विद इन योर बॉडी, दीज आर योर टेस्टर्स सॉर्ट ऑफ पीपल, है ना, मॉलिक्यूल जो कि पता करते हैं भाई ये फिर से भाई कोरोना आ गया हमारे अंदर, है ना।
राइट।
तो वो एंटीबॉडी होते हैं। अब इसका मतलब क्या है, जिसके अंदर एंटीबॉडी मिल गई उसको कोरोना हो चुका है। या इसमें थोड़ा सा ऐसे कंफ्यूजन ये हो जाता है कि जो पहले वाले कोरोना वायरसेस थे, सर्स एंड मर्स वर आल्सो कोरोना वायरसेस, सो
हम्म।
इट डिटेक्ट्स द होल फैमिली ऑफ कोरोना वायरसेस। अगर कोई वो भी हो रखा है पहले तो भी आपको डिटेक्ट होता है। अब इसमें क्या देखने वाली चीज है, पहला नंबर बहुत इंटरेस्टिंग है, 0.73% ऑफ द पॉपुलेशन। इसको तुम अज्यूम कर सकते हो पूरे इंडिया में। ये सर्वे हुआ था मार्च एंड में, सॉरी
अच्छा।
अप्रैल एंड में। पहला जो आईसीएमआर ने सीरो सर्वे कराया था अप्रैल एंड
हाँ।
में हुआ था। उस टाइम हमारा निकल के आया था उस सर्वे से कि 0.73 हुआ तो मई में था, बट इफेक्टिवली एंटीबॉडीज 15 दिन में निकलती है, तो इफेक्टिव डेटा इज फॉर 0.73% ऑफ द पॉपुलेशन। इसका ये 1 करोड़ के करीब आता है, 0.73 और 1.38 बिलियन। सो इसका मतलब क्या है कि 1 करोड़ लोग में एंटीबॉडीज थी अप्रैल एंड में। उस टाइम अभी तक 1 करोड़ केसेस नहीं हुए हमारे, देखो अभी तक नहीं हुए, है ना। ये जो आईसीएमआर खुद बोल रहा है 1 करोड़ लोग इन्फेक्टेड थे अप्रैल एंड में। तो अब ये देख लो, अब यही इन्फेक्शन और केस में फर्क है। केस वो है जो कि तुम्हारा सामने आ रहा है। सो दिस इज गवर्नमेंट्स डेटा यार, आई एम नॉट मेकिंग इट अप। केस वो है जो सामने आ रहा है और रिपोर्ट हो रहा है। इन्फेक्शन वो है जो किसी का अगर, अब क्या हुआ है कि अब हम अगर इन्फेक्शन मोर्टेलिटी रेट निकालें, 1 करोड़ डिनोमिनेटर रखे, न्यूमरेटर हम रखे जितनी डेथ्स हुई है। डेथ का भी हमने कई बार कई रिपोर्ट्स में देखा है कि सारे लोग रिपोर्ट, सारी डेथ्स भी रिपोर्ट नहीं होती। कुछ काफी एनेक्डोट्स भी आपने सुने होंगे, है ना, कि डेथ्स भी सारी रिपोर्ट नहीं होती, कुछ कुछ इधर उधर से पता भी चला होगा। तो वो भी थोड़ा इन्फ्लेटेड है, फिर भी अगर हम अज्यूम करते हैं वो मोर और लेस सही है वो डेटा। ये उस टाइम निकल के आया था कि इन्फेक्शन फेटेलिटी रेशो इन इंडिया इज एज लो एज 0.08%। ये आईसीएमआर खुद बोल रहा है, मैंने कुछ नहीं किया, मैंने उनकी स्लाइड का फोटो खींच के लगाया यहाँ पे। सो दिस इज नॉट एट ऑल माय वर्ड्स, इट इज 0.08%। अब हमने इससे पहले देखा था 1.55%, वो है केस फेटेलिटी रेशो। अब इन्फेक्शन फेटेलिटी रेशो इज 0.08%। नाउ दिस इज वेरी गुड, क्योंकि यार जो इन्फ्लुएंजा, नॉर्मल इन्फ्लुएंजा होता है ना, उसका भी लोगों ने रिसर्च निकाला है कि भाई इसके आसपास ही होता है ना। तो फेटेलिटी के हिसाब से, और ये दिस इज वे लोअर देन अदर एस्टिमेट्स, जो दुनिया में आगे और भी एस्टिमेट्स है ना, उससे बहुत कम है।
सो वैभव, ओवरऑल हमें मतलब आई एम लिटिल कंफ्यूज्ड नाउ, मे बी ऑडियंस भी शायद सोच रही होगी, आर वी
थोड़ा
सपोज्ड टू बी
सोच,
स्कैर्ड,
थोड़ा कंफ्यूजिंग है।
are we
We
supposed to be
should be
scared, are
scared.
we supposed to wait, or are we supposed
We
to
right. We should be scared not because this virus is deadly,
okay,
but because it is way too infectious than other viruses.
right, okay,
है ना?
okay.
This virus
But
is not
once the
that deadly.
vaccine is out, is it going to be like any other disease in the past?
नॉट, मेरा जो सेंस है ना ब्रो, मेरा सेंस ये है कि वैक्सीन में अभी क्लैरिटी नहीं है, वैक्सीन इम्यूनिटी कितने दिन तक देगी,
Oh,
है ना। ये भी चीज है ना। अब तुम जब अगर कॉमन कोल्ड की वैक्सीन लगाते हो यार, फ्लू वैक्सीन लेता है जो भी, साल में एक बार लेता है, अगले साल फिर लेनी पड़ती है उसको।
right.
बट ऑन द अदर हैंड देयर आर वैक्सीन दैट चिल्ड्रन टेक, वो एक बार लेते हैं, वो पूरी जिंदगी उनका इम्यूनिटी रहती है।
Yeah.
अभी क्लियर नहीं है, अभी क्लियर नहीं है, इतनी जल्दी होगा भी नहीं कि वैक्सीन की ड्यूरेशन कितनी होगी, है ना। तो हो सकता है भैया एक बार फिर से लेनी पड़े, बार बार लेनी पड़े। तो अगर सिचुएशन आ जाती है कि हम ले रहे हैं, बार बार ले रहे हैं, और एक क्रिटिकल मास इसको ले रहा है, तब ये ऑलमोस्ट कम हो जाएगा वायरस,
अच्छा,
फ्यूचर, है ना। Otherwise, the only way it will reduce is if at least 60% of the population gets infected. उसको बोलते हैं हर्ड इम्यूनिटी। हर्ड इम्यूनिटी आपने बहुत सुना होगा। हर्ड इम्यूनिटी क्या है? हर्ड इम्यूनिटी ऐसी चीज है, अगर 60% लोगों को हो गया वायरस, तो और नहीं फैलेगा ये।
So Vaibhav,
इस
there's
60
another
इस
question.
60 के
Sorry,
अगेंस्ट इंडिया क्या है? हाँ सॉरी,
please, yeah, please continue. Sorry.
इस 60 के अगेंस्ट इंडिया कहां पे, वो नेक्स्ट स्लाइड में आपको पता चलेगा। तो हमने 0.73 देखा है, 0.73 वी आर टॉकिंग अबाउट इन अगस्त एंड, सॉरी
Okay.
इन अप्रैल एंड, इन अप्रैल एंड। नाउ
Right.
3 days back, ICMR did a press conference, and next slide is what they showed.
Sure. So before we go to
Again,
the next slide, I had a question from the comment section.
Right.
What we are getting to know is, I don't know exactly if you know, probably if you're following Dr. Vishwaroop,
Mhm.
he has been claiming something very different with proofs, something very different, that corona तो है ही नहीं, कुछ ऐसा है, this people or doctors are saying corona जैसी कोई चीज है ही नहीं, it's a scam, you're not supposed to wear your masks and you're supposed to throw it away. Then there is another comment which says there are plenty of videos going viral on social media where it's showing how doctors are not testing properly by giving
Yeah.
fake reports ahead for the data collection.
तो जो सेकंड वाला क्लेम है दैट माइट बी ट्रू एनेक्ट
Okay.
अब ये ना थोड़ा सा लोगों को समझने की जरूरत है
Hmm.
एनेक्डोटल एविडेंस एक होता है और एक रिसर्च एविडेंस ये थोड़ा सा फेक न्यूज में ये फेक न्यूज की दुनिया में ये थोड़ा देखने की जरूरत है कि
Okay.
एनेक्डोट ये भाई उसने कहा ये हुआ है
Hmm.
ना अब अनलेस देर इज रिपोर्ट विच इज साइंटिफिकली प्रूवन हमें किसी चीज को
Hmm.
मानना नहीं चाहिए पहली बात ये
Okay.
है ना साइंटिफिकली प्रूवन क्या है साइंटिफिकली प्रूवन वो चीजें होती है जो रिसर्च पेपर छप गया है ऐसा भी नहीं भी
Hmm.
प्री रिसर्च भी है छप गया
Hmm.
है और रेप्यूटेड जर्नल ने छाप दिया
अच्छा.
तो अगर जो ये आपका वो है ना कोविड जैसे मेडिकल चीजें उसमें
Hmm.
उन चीजों को ही मानना चाहिए भैया जो रिसर्च पेपर छपा हुआ है लोग
Okay.
कह रहे हैं however highly reputed they are whoever even I am saying anything don't believe
Very true.
unless we are talking about some published research in
That's a very
anything
good
which is
advice. I think I
है
appreciate
ना
that advice, and I'm
हम्म,
sure ये वाला आंसर भी मिल
that
गया
is
होगा जो देख रहे हैं.
yes जो पहला
Hmm.
जो चीज है जो क्वेश्चन है ना कि है कि नहीं है अ, ये इसमें आई विल गो विद व्हाट ऑल्दो WHO एंड इंडियन गवर्नमेंट ICMR कुछ कुछ सवाल उठाते रहे इन पे लोग बट दीज आर वेरी रेप्यूटेड बॉडीज है ना
Okay.
दीज आर वेरी रेप्यूटेड बॉडीज कुछ कुछ WHO पे बहुत सवाल उठे हैं ICMR में भी कुछ 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 डॉजी चीजें करी हैं बट दीज आर वेरी रेप्यूटेड बॉडीज इफ दे आर सेइंग सो वी शुड 110% बिलीव दिस इज ट्रू है ना
Right.
go
Absolutely.
by
Absolutely.
and a lot of research has been done on this virus published research है ना
Hmm.
in reputed which has very high integrity sort of Lancet करके जर्नल है उसमें काफी लिखी गई है इस वायरस के बारे में तो
Right.
go there check it out for yourself these are the places
Hmm.
only we should believe है ना so that
Great.
is what it is and we should not go for this fake news sort of thing
Perfect.
second
Vaibhav,
question जो है
should,
it could
should
be
I
true
move to the
yes
next slide, or you have to continue? Sorry.
डेटा डेटा वाला हम देखते हैं कुछ कुछ हाँ
Okay.
नेक्स्ट स्लाइड सीरो सर्वे वी आर टॉकिंग अबाउट व्हाट इज द
Oh.
सिचुएशन दिस the second zero survey ICMR came out with I think you can check out their YouTube video on
Sure.
PIB is
Sure.
Press Information Bureau they have a YouTube channel वहां से मैंने बिकॉज पहले दे यूज्ड टू पब्लिश स्लाइड्स अब वो पब्लिश स्लाइड नहीं करते बट ऑन द यूट्यूब चैनल्स यू कैन सी क्या समझ में आ रहा है इसमें इन्होंने फिर से सर्वे किया है सेम सर्वे
Hmm.
जो इन्होंने
Hmm.
अप्रैल लास्ट में जो बता रहा था
Hmm.
0.73 अब वही सर्वे वैसा ही सर्वे अराउंड 6.6 7.1% बता रहा है
अच्छा.
एंड ये हुआ है अगस्त टू सितंबर में तो इसको तुम एवरेज अगस्त एंड मान सकते हो और अगस्त 15 अगस्त मान सकते हो इसकी डेट जिसका ये डेटा है ना
Oh.
अगर
अच्छा.
ठीक ठाक मानेंगे 15 अगस्त 20 का डेटा अगर मानो तो 7% के करीब इन्होंने बोला है कि इंडिया में पूरे इंडिया में लोगों को सैंपल निकाल के लिया है पूरे इंडिया में लोगों को इनके हिसाब से कोरोना हो चुका
Oh. Okay.
है ना
अच्छा.
so this is what I'm saying is slightly incorrect a more scientific way to say it is in the sample that they collected है ना hopefully these people are scientists they collected
Hmm.
good with a good sampling methodology they collected a sample and around 6.6 to 7.1 is the in the adults that is the number
Okay.
6.6 you can say है ना
Okay.
अब 0.73 से हम 6.6 आ चुके हैं
अच्छा।
हमें हर्ड इम्यूनिटी लेने के लिए 60 चाहिए. दैट्स नॉट अ गुड सिचुएशन टू बी इन, बट अगर आप सवाल पूछो कि भाई कब कम होगा ये, है ना, तो देर इज हर्ड टू गेट हर्ड इम्यूनिटी. There is a long way to go. Already we are seeing, and I also believe somewhere we have peaked as well in terms of daily new cases, है ना, जो जिससे हमने शुरुआत करी थी.
बट
तो
बात वही है दैट इफ वी हैव एक्चुअली पीक, तो उसके बाद इन्फेक्शंस तो फिर से होते ही हैं, बिकॉज
double peak can, another peak can happen. No? That is how it started. We have to be
या
very, we should not be complacent. Still we have to open up. हम open up
या
करे नहीं अभी तक, है ना, and we have to have the behaviors that we have taken up in these 6 months,
इट्स
है
जस्ट
ना,
दैट
we have to
आई
continue.
डोंट वांट दैट इट बिकम्स लाइक अ लूप, where you're
Right,
stuck. That's
right.
the only thing we're
और
concerned about.
यस, दिल्ली पॉपुलेशन, दिल्ली, अब आप देखोगे दिल्ली में 2 सीरो सर्वे हुए हैं. एक
हम्म.
राउंड वन, नीचे जो देख रहे हो, राउंड वन, राउंड टू.
बिल्कुल.
राउंड वन में निकल के आया था जुलाई एंड में 23.5% पीपल इन दिल्ली आर ऑलरेडी इन्फेक्टेड. राउंड टू में निकल के आया था 29.1% पीपल इन दिल्ली आर ऑलरेडी.
हम्म.
सो दिल्ली एज अ होल अराउंड 30% यू कैन से, वन 10 में से 3 आदमी को अभी तक हो चुका
बाप रे.
है ना. मुंबई स्लम्स में तो और ज्यादा परसेंटेज निकल के आया था. So these numbers are unprecedented across the
and
world. This is also the second point
and
we
this
need
is
to.
after doing limited number of tests. This is not after, you know,
This,
obviously it's not
so
humanly possible to do all the tests in Delhi.
yes, exactly, not humanly possible. Delhi
Well,
anecdotally, I'll go against what I also only said, but go by published research. But Delhi anecdotally, people are saying is governance of this medical governance has been relatively better than other places. जो मेरे को
has
समझ में
relatively
आता है,
been.
बेटर जो मैनेजमेंट है कोविड की, वो ठीक रही है दिल्ली में, और जो
Okay.
लोगों से भी मैंने सुनने में. बट अगेन दिस इज एनेक्डोटल, यू शुड नॉट गो बाय these words.
Well,
Okay, so I think these are the
yeah,
points we can look at. नीचे अगर if you can go to a few more slides, I'm not sure
sure,
what is your,
sure.
uh, हाँ, ये this is IFR we talked about it. So next slide, if you can come to 0.27 is the global ISR median, है ना. So
Okay.
इंडिया में जो ICMR नंबर लास्ट सर्वे से बोल रहा है 0.008, तो वर्ल्ड वाइड ये 2.7 के करीब, 0.27 के करीब बताता है. और आगे चलेंगे. एक और इंटरेस्टिंग चीज है कोविड में यार. कोविड में 80% जो वो है ना केसेस,
Hmm.
वो सुपर स्प्रेडर्स करते हैं. ये बहुत इंटरेस्टिंग चीज है.
Okay.
देयर आर,
If you
सो
can give us an example, जैसे कि.
जैसे यार एक केस हुआ था कोरिया में.
Hmm.
कोरिया में देयर वाज अ गाय हु वेंट टू अ लॉट, पार्टीइंग अ लॉट एंड ऑल दैट. ही वाज, उसको कहते हैं पता नहीं 50-60% ऑफ द होल कंट्रीज, क्या नाम है, इन्फेक्शन इज ओरिजिन टू हिम.
Hmm.
पंजाब में आई थिंक देयर वाज अ केस ऑफ सुपर स्प्रेडर. Basically, what research is coming out and saying is that there are, of those who get infected, 10 to 20% of those account for 80% of the infections. तो
Okay.
अगर 100 लोग होते हैं, उसमें से 10 लोग ऐसे हैं जो बहुत ज्यादा फैला रहे हैं. इनको बोल रहे हैं सुपर स्प्रेडर्स,
Okay.
है ना. तो ये
Okay.
थोड़ा से बाकी इन्फेक्शन से थोड़ा कुछ कुछ अलग है चीजें. तो सुपर स्प्रेडर्स का कॉन्सेप्ट है इसमें,
अच्छा.
क्या नाम है, कोविड में.
ठीक है.
I'm not
Very
sure if we
interesting.
missed something. Can we come to the next slide?
Sure.
Vaccines we have taken up. I think we have covered most of it.
We
Science
covered
वाली
most of
slide
it.
में we have
Sorry.
skipped a few things. I know. एक बार इससे दो पहले वाली स्लाइड जाना. ये
Sure.
जो इससे पहले वाली, हाँ, ये एक कोविड ट्रैकर टाइप है कि कौन कौन सी वैक्सीन चल रही हैं इंडिया
Oh,
में.
अच्छा.
3 वैक्सीन अभी तक, और किस स्टेज पे है. तो
This is
तीन ऐसी
interesting.
वैक्सीन है। हाँ, तीन ऐसी वैक्सीन है जो कि लिमिटेड यूज के लिए अप्रूव हो चुकी है। एक तो
Mm-hmm.
रशियन वैक्सीन है और दो
Okay.
चाइनीज वैक्सीन
Hmm.
है ना।
Right.
चाइना ने भी अपनी आर्मी और इन सब के लिए कुछ वैक्सीन का यूज स्टार्ट कर दिया
अच्छा
और रशिया ने तो कर ही दिया इसका, है ना।
अच्छा अच्छा।
हाँ,
सो
और
हम ही रह गए
जो
बस।
नहीं नहीं ऐसा मतलब इसमें ऐसी चीज नहीं है हम रह गए एंड ऑल दैट, क्योंकि जब तक रिसर्च ठीक नहीं आती ना, या आई एम नॉट श्योर इफ एनीबॉडी शुड
ट्रू।
बी। जो लास्ट जो लाइन है वो इंडियन वैक्सीन है, बोथ ऑफ देम आर इन फेज 2।
राइट।
भारत बायोटेक की कॉन्साइनो है, जाइडस कैडिला की एक वैक्सीन है। और जो बीच में सारी वैक्सीन है, एक दो तीन चार, अ, एक दो तीन चार पाँच छः छः वैक्सीन है।
हम्म।
वो फेज 3 में है। तो मोडर्ना जो हमने ग्राफ में भी देखा, पी फाइजर एंड एस्ट्राजेनेका एंड दीज टू चाइनीज वैक्सीन्स एंड देन मर्डॉक चिल्ड्रंस रिसर्च इंस्टीट्यूट, ये ऐसी वैक्सीन है जो कि फेज 3 में चल रही है ना, ये लास्ट उसमें।
वेरी इंटरेस्टिंग। या
राइट।
lot of
सो
data has been taken out by your team. I think it's amazing the kind of efforts you guys have done. Very
So it
appreciated.
efforts are continuous over the weeks. Na? It doesn't take me more than 2-3 hours for the week, but across the weeks it
Oh,
is looking at like a lot. Right.
wonderful.
I think some last में जो science वाला section है उसमें भी कुछ कुछ देख सकते हैं हम।
Sure, sure,
If
sure. आप
we
बताइए which slide?
एक, हाँ आगे चलिए। ये स्लाइड बता रही है कि भैया क्या काम करता है यार। तो इसमें कह
Mm-hmm.
रहे हैं कि मास्क N95 बेस्ट है, ये जो निकल के आया है ना, ये लोगों को जानकारी इंपॉर्टेंट है।
Hmm.
आई प्रोटेक्शन भी इंपॉर्टेंट है आपकी, है ना। और फेस मास्क इंपॉर्टेंट है ना, और उसमें N95 सबसे ज्यादा बेटर रहता है, और शॉर्ट डिस्टेंस वाला सबसे ज्यादा क्या नाम
Right.
है,
Okay.
ज्यादा दूर रहेंगे तो उतना ज्यादा अच्छा है, तो डिस्टेंस बना के रखें
So face
N95।
mask versus no face mask. Okay. Right.
यस।
Right.
सो
Hmm.
लार्जेस्ट, सो दीज राइट में जो ग्राफ है वो लिखा हुआ है कि चांस ऑफ वायरल इन्फेक्शन और ट्रांसमिशन, है ना। तो अब पहले
Right.
देखोगे शॉर्ट डिस्टेंस में 12% का है, फर्दर डिस्टेंस 2.6% का है, मतलब इतना परसेंट का 11% का डिक्रीज हो जाता है चांस, है ना। फेस
And
मास्क
face
लगाओगे,
mask. No eye protection. Oh, no eye
आई
protection is a high
प्रोटेक्शन,
number.
हाँ आई आई प्रोटेक्शन और नो आई प्रोटेक्शन में भी डिफरेंस है। तो आई प्रोटेक्शन ऑल्सो क्या नाम है, इज ऑल्सो इम्पोर्टेंट।
Yeah, I think mask. Someone has actually commented saying that mask is no mask is an example. Trump ka.
Trump is doing politics. Trump,
That's a
you know
strong
what?
statement.
Trump's case is very interesting. I have to point it out. So he was saying hydroxychloroquine, this, that, but when he got infected, it's sad news that leader is infected. What he's getting is your क्या बोलते हैं, रेमडेसिविर।
Okay,
So उसने खुद वो कह रहा है, इतने दिनों से कह रहा है हाइड्रोक्सीक्लोरोक्विन बेस्ट है, बट खुद
okay.
इन्फेक्ट हुआ तो डॉक्टर की मान रहा है वो। So clearly he's doing so he's taking the drug which is researched and found out through research, remdesivir is really effective. That is what he's going
But
to.
for me, and I think for a lot of people who are watching this right now, the no eye protection is a shocker to me.
Yes, so go for eye protection. This just says go for eye protection.
That's a high number. That's almost just touching. Wow.
Right,
So I
go
think
with mask.
eye
Go
protection
for
is
eye.
something not all of
Is
us
it?
has been taken care of. So that is a clear sign that guys, if you're not protecting your eyes, you're not wearing those transparent goggles, as they say.
नहीं,
It's very
normal goggle
important.
पहनो तो protect your eyes, है ना। That is this
How
is
do I
right.
protect
This
my eyes? What do you suggest? How do you protect
I
them?
think you are wearing your, इन्होंने तो शायद गॉगल्स फेस शील्ड से ही करा है, बट फेस
Okay.
शील्ड्स का थोड़ा सा मिक्स सा आ रहा है। है ना?
हाँ
है ना? तो
वही.
आई एम नॉट श्योर अबाउट फेस शील्ड, सो वेयर योर गॉगल्स नॉर्मल व्हेन यू आर आउट. वेयर योर नॉर्मल गॉगल्स व्हेन यू आर आउट. मैं तो आई एम नॉट एन एक्सपर्ट, बट दिस इज व्हाट वी हैव कम अक्रॉस फ्रॉम अ रिसर्च रिव्यू. उन्होंने क्या किया था कि कई सारी रिसर्च उठा के एक जगह रिव्यू
No, of course,
करी.
research is what we are based on, and that's what
Right.
brings
So
us with
just
a lot of
go
insight.
for your mask. Go for some sort of a eye protection. That is important.
This was
Can
a
we
very
go
interesting slide, actually.
right? Can we go to the next slide?
Sure.
Uh, this is interesting कि कितने दिन में 5-6 दिन लोग इस मतलब कोई सिम्टम नहीं दिखाते. तो the graph is how does the viral load कितना बढ़ता है, कैसे कम होता है ना?
Okay.
अभी रिसेंटली हमने देखी थी रिसर्च, वो कह रहे थे कि people are most क्या नाम है, infective a few days before and few days after their symptoms. So that is what that research was saying. कि
So that's
अगर
a difference of 10 to 15 days, maximum
this is
18
this
days,
is
we find.
this is this is 25 days cycle, जिसमें ये थोड़ा ये भी बता रहा है हाई सेंसिटिव टेस्ट कब तक डिटेक्ट कर पाते हैं, लो सेंसिटिव कर पाते हैं.
Hmm.
बट ये इट इज अनकनेक्टेड टू दिस रिसर्च व्हाट आई एम टॉकिंग अबाउट, कि जो डे
Okay.
5 है ना, उससे 2-3
Hmm.
दिन पहले 2-3 दिन और उसके बाद 2-3 दिन लोग सबसे ज्यादा ट्रांसमिट करते
Oh,
हैं, है ना?
okay.
And although this is that is what I read last week, I can give a reference to that. Uh, but this is saying that the viral in your body,
Mm-hmm.
how does it grow and how does it drop down? है ना? So
Hmm.
it is the most between 5 to 10 days.
Hmm.
5 से 10 दिन तक सबसे ज्यादा रहता है तुम्हारी बॉडी में.
So that's when the person is a super spreader.
That's when the person is inside most susceptible to getting कॉम्प्लिकेटेड, है ना?
Okay. Okay.
तो अंदर ये अंदर की काइनेटिक्स है, बाहर की
Right.
अलग होती है. ठीक है, वी कैन गो टू द नेक्स्ट स्लाइड.
So,
सुपर स्प्रेडर्स आर केसेस, है ना? ऐसा नहीं कि सारे बंदे सुपर स्प्रेडर बनते हैं. वो पता नहीं अभी तक किसी को कौन सुपर स्प्रेडर है ना? ये भी ये थोड़ा सा टेक्निकल है, वी कैन स्किप ऑल दिस. किसी को पढ़ना है तो यू कैन शेयर दैट. आगे 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 कर. So this is one of the drugs. There are 3 drugs which are showing. Third one I'm forgetting.
mhm.
First one is remdesivir. Second one is this dexamethasone, and this is very cheap. और ये इस
Yeah.
तरह से इसमें लिखा हुआ था, इस जो आर्टिकल आई रेड ओवर इट, that it could have reduced 10% of death if this was known that this was effective in UK.
Right.
So 10% डेथ प्रिवेंट हो जाती अगर ये पता होता कि, और ये पहले दिस इज अ sort of steroid which improves the chances of people to
Okay.
live. That's not this one. When we come to the next slide, I'm not sure what is there. So last section I had kept
So,
to
is this
see. I think
presentation, Vaibhav, because we're a little
share
short
about,
of time on the show, is it
yeah.
possible that this presentation can be, sent on a link or the public can view it? Is
Let me
that possible?
see. Let me see what what all I can share.
Right, because we're a little short
Few
of
slides,
time.
yeah, few slides I won't be able to share.
Sure,
Some of it I will share.
sure. So I think it was a great session. My audience must have really enjoyed all of these guys. Dillistan में बहुत अच्छा लग रहा है that you shared
Right.
so much information. But I really wanted to go ahead, but because of the time
Sure, it's fine.
constraint,
It's fine. It's fine. This is fine. I have a request to Vikram. So, in my work with the non-profit, we have a brand of handicrafts that we are
sure.
promoting. It's called
Oh yes,
Samuday
I'd
Craft.
like to. I actually went through that link, Weber, and I found this really interesting. So I thought if I can actually share the Instagram page, because if people
Please do.
follow this page, it'll be really interesting for them to go through it. Just a second, I'll share the screen.
Right. So, in my work, I also work in UP with these villagers, and one of the work that we do is this handicraft that we make with the women there, and so we have been working on this for a couple of years now, and we train these women on these craft, and we come up with these beautiful products. And it would be great if you can check
Sure.
this Instagram page out. It's called Samuday Crafts.
I'll just
I'm
do that.
not sure. Yes, please. So if you can just show the products as well,
I'll just
it
do
has
that.
a yes, right. So we make these dupattas.
Is it visible? Yeah.
Yes, yes.
Yeah.
So I'll come to the bag, one of the bags. That is very interesting. The bags are very interesting.
Sure.
So the bags are made of recycled your cement bags. Not this one. Not this one.
This
Yeah,
one.
this one. Yes.
Wow.
So we
That's
use
pretty.
cement bags. We recycle them. Hand embroidery is done by these women on that, and they are
Oh, okay.
stitched in the villages only. And uh, we are there on a few online platforms. Okai, we are there
Okay.
on, and
Okay.
Instagram. If you can just follow on Instagram, that would be great.
Sure. So, guys, everybody, all the listeners are watching us on YouTube or watching us on Facebook right now. Please follow this account. It's on Instagram, and you're gonna find some very interesting crafts, authentic handmade products, impacting 400 rural artisans, as they say. So, if you want to support them, there are lovely creative people out here. Check out this cushion. Check out the bags. I think they're very interesting, and I've already shown this to my family. They already are in love with it. And I
Great,
have
great.
followed you as Team Dillistan, Vaibhav. We followed this page, and we look
Thanks, man.
forward for everyone to follow because this is how while you on the go and you actually support people who are in need.
Right.
So I'm going to be very happy for if people are going to follow this, I'm going to be very happy as well. I love such amazing amazing things out there which are creative because I myself I belong to a background which is creative. So I totally understand this.
Right.
Thank you so much. I
Thanks,
think it was
Vipram.
amazing.
Thanks for this.
Vaibhav, thank you so much for your time. You've given us such precious time of yours. It's been an amazing session, and
Right.
though we fell short of time, but I would like to again, very soon call you and to have an interesting chat, maybe before the vaccine is, of course. So
Right. So
yeah,
I am interested in this, and also if you want to discuss Indian economic situation or
wow.
education or general apart from COVID, I'll be open to. I have certain interests as well. If you are interested in, I'm not an expert in those areas, but I'm interested in human
So
psychology.
how many options do we
Somewhere,
have? We have Indian economy. What else is
yes.
there?
Indian
What
economy,
else?
education,
Education.
agriculture. Yeah. So all these things, if you are interested to look at, we can do some session on that, short session on that.
Wonderful. So I think our
Yes.
audience is going to be the best judge to let us know
Please,
what they're
please.
interested in. Yeah.
I'm
So
also
I'm going to
interested
ask
in
everybody
these,
to comment.
yes, human psychology. I'm very interested in as a person to try.
Oh,
Yes,
very
but I'm not an
interesting.
expert at all. But we can, as general people, we can discuss and we can bring in
So
some.
do we have another research on that with great insight?
I no research. I just read about it. There's no research on that. I do, but I
Wonderful.
just read about it and I'm very interested in.
Awesome. That sounds amazing. I think I'm always up for these kind of sessions because I'm kind of person who probably doesn't read a lot since the beginning, but I love to hear things out. I love
Right,
videos, I love visual things and talking to people and getting to know so much. So I think it's a great
right,
way for everybody at the Lisan as well to learn and get experiences out of people. And that's why we always call personalities who are inspirational. And you are an inspiration, sir. Thank you so much
Correct.
for visiting this show. And
I
we
don't think so.
we
Uh,
no, you are. I mean, this kind of a research is something which probably people haven't done. They've been doing something out there which is probably not maybe as developing for their thing. But you have actually gone through this kind of an amazing research. We wish you all the very best, and
Thanks a lot.
uh, we wish you all the very best. And please be safe. Uh,
Right, of course, you as well.
yeah, and thank you for coming.
So
And we're gonna be in touch.
whenever we are able to, please, we would for sure meet in person.
Of
Whenever
course, of
this,
course,
you
of
know,
course. I'm
it
always
was
up
great.
to meet. You're already you're a friend now, right?
Right,
You're
right,
you're the Dillistan friend, and I'm always up
right,
to meet new people and new friends, and that's what I'm all about. I'm also called the Dilli Wala Bhai. Apart from this show,
right,
it's a character
right,
I'm playing at Dillistan. So
right,
do watch those series, and you'll get to know how friendly I am.
right. Great. Good to
Right?
know. All right.
Thank you so much,
Thanks a
Vaibhav. It was great
lot.
talking to you. Wish you all
Right,
the
right.
very best. Thank you.
Thank you. Thanks. Thanks.
So that was Vaibhav Chauhan. I really had a wonderful time learning so much from his session. I hope you guys also had really a good time. We probably took a lot of time of yours, but then yes, it's very interesting. We got to know a lot of things, a lot of insights. We got to learn a few things. Yes, there is a bit of a bad news, but there is some good news as well. Um, while the vaccine doesn't come out, guys, just be a little safe. Use your face mask, use your shields. You're going to be protecting everybody else, and you're going to be protecting yourself. So why not be safe rather than messing it up? Because I see a lot of people out there who are not bothered anymore. Delhi is getting affected, guys. Dillistanis, please ध्यान रखो. दिल्ली एनसीआर में बहुत ज्यादा केसेस बढ़ रहे हैं. ध्यान रखिए अपना. लोगों को खुद से बचाइए. खुद को लोगों से बचाइए. सोशल डिस्टेंसिंग को अभी भी रखिए. ऐसा नहीं है कि सब खत्म हो गया. सो बहुत लंबा टाइम ले लिया आपका, बट आई वुड से जस्ट टेक केयर ऑफ योरसेल्फ, बी वेरी केयरफुल. एंड बाहर थोड़ा जाइए, जरूर जाइए, काम होता है सबको, सब कुछ करना पड़ता है. बट अपना ध्यान रखना, अपना बारे में सोचना, अपनी फैमिली के बारे में सोचना इज द फर्स्ट थिंग यू शुड डू. Thank you so much for watching the show. It was a great, great, great session. Chat trap on Dillistan देखते रहिए. अगर आप YouTube पे देख रहे हैं हमें तो प्लीज सब्सक्राइब करिए प्लीज, सो दैट आई कैन एक्चुअली कम अप विद नाइस वीडियोस. आपको नोटिफिकेशन आएगी आपके फोन पे, तभी तो मैं आपके पास ऐसी इंटरेस्टिंग वीडियोस लेके आऊंगा. सो प्लीज, थैंक यू सो मच फॉर गिविंग सो मच, सो मेनी गुड कमेंट्स. इतने इंटरेस्टिंग इंफॉर्मेटिव सेशन है, सब बोल रहे हैं, एंड आई एम ग्लैड टू शेयर दिस काइंड ऑफ अ सेशन. यूट्यूब पे सब्सक्राइब करिए, बेल आइकन को दबाइए, सारे वीडियोस की अपडेट्स लीजिए, और फेसबुक पे लाइक करिए पेज को, वीडियो को शेयर करिए. एंड स्टे ट्यून टू दिल्लिस्तान. नेक्स्ट वीक फिर से आएंगे एक बहुत इंटरेस्टिंग गेस्ट के साथ. सो टिल देन, स्टे ट्यून टू दिल्लिस्तान.